Imagine working 50 hours a week. Imagine paying property taxes, sales taxes, gas taxes, healthcare premiums, and deductibles. Imagine putting off physical therapy because you can't afford it. Then imagine discovering that someone sitting in a jail cell receives doctor visits, prescriptions, mental health services, specialist appointments, transportation, hospitalization, and even physical therapy, all at taxpayer expense. Now, before somebody starts screaming that we're attacking the Constitution, let's be clear. This isn't about whether inmates should receive necessary medical care. The real question is this: how did we build a system where working families struggle to afford health care while local governments spend millions caring for inmates and then come back to taxpayers asking for more money? Tonight we're following the money, and the numbers are staggering. From Seattle to Los Angeles, this is Left Coast News. No apologies, just the truth. Welcome back to Left Coast News. Today we're looking at one of the most expensive and least discussed burdens facing Washington taxpayers: inmate health care. This isn't a small line item buried in a budget. It's a growing financial crisis impacting counties, cities, sheriff's offices, local police departments, and ultimately every taxpayer trying to make ends meet. The deeper you dig into the numbers, the more unbelievable the situation becomes. The state prison system. Let's start with the Washington Department of Corrections. Washington currently spends approximately $185 million to $200 million every year on inmate health care alone. That's nearly 1/5 of the entire corrections budget. Think about that. For every dollar spent operating prisons, roughly 20 cents goes directly to health care. The average annual health care cost per inmate runs approximately $13,000 to $15,000 per year. For some medically complex inmates, the actual cost can be substantially higher. Taxpayers fund doctors, nurses, dentists, mental health professionals, prescription medications, specialty care, hospitalizations, emergency room visits, physical therapy, chronic disease management, and that's before we get into county jails, where the counties get crushed. The real crisis isn't actually the state prison system, it's county jails. Large state agencies have billion-dollar budgets. Small counties don't. Lewis County doesn't. Pacific County doesn't. Grace Harbor doesn't. And Mason County doesn't, along with dozens of other counties that don't. They operate on tight budgets with limited revenue and little room for unexpected costs. Then one inmate has a heart attack, or cancer, or a severe psychiatric crisis, or a major injury. Suddenly, taxpayers are looking at bills that can reach $50,000, $100,000, or more for a single inmate. And the county has no choice. They must pay. Not can, not should, must. Because federal courts have repeatedly ruled that denying medically necessary care to someone in custody creates constitutional liability. The Medicaid catch. Here's where taxpayers really start asking questions. A working citizen may qualify for nothing. They earn too much for assistance. They pay their own premiums, their own deductibles, their own copays, their own prescriptions. Yet when someone enters jail, counties frequently become financially responsible because of federal Medicaid restrictions on incarcerated individuals. The result? Costs shift from federal programs to local governments, and local governments fund themselves through taxpayers. In plain English, the bill eventually lands on your property taxes, sales taxes, criminal justice taxes, and county budgets. The hospital guard problem. Now let's talk about the hidden expense almost nobody sees: the hospital guard detail. Suppose an inmate needs surgery. The medical bill isn't the only cost. The jail has to post deputies or corrections officers around the clock. 24 hours a day, 7 days a week, sometimes for weeks. One hospitalized inmate can generate enormous overtime expenses. 2 officers, 3 shifts, multiple days, overtime, backfill staffing, mandatory callbacks. The actual healthcare bill may only be half the cost. The security requirement can become just as expensive. County commissioners across Washington have repeatedly warned that these cases can blow holes in annual budgets. The Lewis County example. Let's bring this home. Lewis County contracts with NAPCare for medical services and separately funds behavioral health programs. The county has had to expand mental health funding and seek additional resources just to meet required standards. Cities like Centralia and Chehalis pay bed rates to house inmates. As healthcare costs rise, those rates rise. When those rates rise, city budgets get squeezed. When city budgets get squeezed, taxpayers eventually feel it. It's the classic government domino effect. One cost increase moves through the entire system. The vendor monopoly problem. Another issue almost nobody discusses: competition, or more accurately, the lack of it. Many counties report receiving only one serious bidder when jail healthcare contracts come up for renewal. One. Not 5, not 10, one. That means counties have very little leverage. If a vendor demands significant increases because of labor shortages or inflation, counties often have no realistic alternative: pay the increase or risk constitutional violations and lawsuits. That's not a functioning marketplace. That's government operating from a position of weakness. The lawsuit trap. And this is where county officials get trapped. If they spend more money, taxpayers get angry. If they spend less money, they get sued. Federal civil rights lawsuits involving inmate medical care can result in large settlements, jury verdicts, attorney fees, increased insurance premiums, and even when counties ultimately prevail, litigation itself is expensive. County leaders know that paying for treatment today may be cheaper than defending a lawsuit tomorrow, so they spend, and taxpayers pay. Again. The fairness question. Now let's address the elephant in the room. The issue many taxpayers raise isn't whether inmates should receive emergency care. Most reasonable people agree that they should. The issue is fairness. A working family can easily spend $1,200 to $1,800 per month on insurance premiums, thousands in deductibles, thousands more in out-of-pocket expenses. Many people delay MRIs, delay specialist visits, delay physical therapy, delay surgeries, not because they don't need care, because they can't afford it. Yet governments are legally required to ensure care for individuals in custody. That disconnect is what frustrates taxpayers, not necessarily the existence of inmate health care, but the fact that law-abiding citizens often feel like they come last. What happens next? The problem isn't getting smaller, it's getting bigger. Washington's inmate population is aging, mental health needs are increasing, behavioral health mandates are expanding. Medical labor shortages continue, healthcare costs keep rising, and county budgets remain limited. Without reforms, taxpayers will continue seeing higher jail contracts, more criminal justice taxes, more county budget pressure, and less money available for roads, parks, public safety, and other services. Something eventually has to give. The Constitution requires governments to provide medically necessary care to people they incarcerate. That reality isn't changing anytime soon. But taxpayers have every right to ask hard questions. How much is enough? Why are counties being forced to shoulder so much of the burden? Why do working families often struggle to obtain care that inmates receive as a guaranteed service? And perhaps most importantly, why does government always seem to find money when it has a legal obligation, but never when it's the taxpayer standing in line needing help? Those are questions worth asking because every dollar spent comes from somewhere, and increasingly it comes from the same taxpayers already struggling to pay their own medical bills. Thank you for watching Left Coast News. Please like, share, follow, and drop a comment below with your thoughts. What do you think about inmates getting medical on your dime while you struggle to pay your own bills? Maybe you don't even have medical. You can find us on YouTube, Rumble, Brighteon, BitChute, Patreon, Facebook, X, Truth Social, Instagram, TikTok, and Spotify. Thanks for watching.